trauma, most common. Traumatic, but after the advent of CT, according to the CT grading, whether hilum is involved or not, only peripherally spleen got injured, etc., etc., you have got a classification of the splenic injury, and accordingly you can take a call whether to do splenectomy or not. Commonest cause क्या होता है acute pancreatitis के लिए? How many of you answered alcohol? Alcohol? Gallstones. We are living and loving in the world of obesity, starting right from the kindergarten. We are fighting to become thinner, thinner, thinner. Now it is only one child option. So all what parents are, they have to feed the child. Correct, sir. No, I am not talking about children alone. I am starting the story from child. Obesity, ultimately gallstones, and gallstones ultimately lead to. Acha, you want to say trauma? Overall, if you take children versus adults, adults suffer more pancreatitis, and most common of all individual causes, children, adults put together is gallstones. Are doctor? Huh? So, what is the early symptom of rectal cancer? Rectal cancer. Yeah. Then is bleeding per rectum is the early feature, not the pain. Is the most common symptom is bleeding. Yeah. Now, probably our online students need to restart the browser so that they can overcome it. Now, Meckel's diverticulum was the most common presenting feature. Painless rectal bleeding is what you need to basically remember. Solitary rectal ulcer. Basically, it takes the form of an ulcer in the anterior wall of the rectum, which is true. Then it can be mistaken for a rectal carcinoma, and if there is a bleeding and discharge, it does not most commonly require rectal excision, right? So generally, if you can solve that organic problem leading to the constipation, rectopexy, then most of the times it takes care. So you have to do defecography, transrectal ultrasonography, anorectal manometry. Constipation is a very big problem, doctor. After 70, life is miserable. You don't know which malignancy is going to come. You don't know which pain is going to start. So grandmas and grandpas will be very happy. That's the reason whenever a grandchild is a doctor, at least somebody to listen will be there. Huh? So, but we need to learn and like the habit of listening. Peutz-Jeghers is autosomal dominant. Then Hirschsprung, what you have is an atrophy of the intramural ganglion cells, and there is a hyperplasia of the extramural parasympathetic area, and there is a increase in acetylcholinesterase activity is what you have to basically remember. Right. Krishna Murali says no audio, please check. Right. I think audio for others is audible. Maybe you need to check the local setting. Now, carcinoid appendix. Frequently it involves the distal third, not the proximal third, is what you have to basically remember. As you can see, a typical appearance of the carcinoid of the appendix. Now, what is an interceptive? Interceptive is the one which interferes at the level of ovulation, fertilization, even implantation. That's the reason it is effective only in the first 48 hours is not true. Deep dyspareunia is not a feature of the Bartholin's abscess. Basically, if the abscess is not there, the Bartholin duct cyst will be like an asymptomatic finding. Ultimately, if there is any induration, inflammation, then while walking, sitting, sexual intercourse, there will be a pain in the vulva, not a deep dyspareunia. That's the point. So for the contraception after delivery for a mother who plans to breastfeed, what will you use? You want to use something that doesn't interfere with the breastfeeding. So, good. So that is the reason we don't use combined oral contraceptive pill. This was the Bartholin's duct cyst which lead to the pain at the time of intercourse. At most it can lead to the pain due to the induration. A 50-year-old woman presents with the night sweats and hot flushes, menopause. In menopause, because ovary doesn't function, doesn't produce estrogen adequately, nobody to suppress the FSH, so FSH levels are elevated. He is what you need to remember. Those who are taking oral contraceptive pills, they have a venous thrombotic tendency. A 35-year-old woman has severely diseased tubes. On laparoscopy, uterus is normal. What do you want to suggest her? In vitro fertilization, it is an indication. Infertility, doctor, 7th or 8th most high yielding topic in the top 20 list in gynops. What is the WHO semen standards? What are the different protocols of ovulation induction? What is meant by ovarian hyperstimulation syndrome? These are all the issues examiner will like to test in the entrance exam. So what is the treatment of endometriosis? Basically, danazole, norethistone, total hysterectomy, not clomiphene citrate. So you use progesterone, hormone contraception, danazole, gonadotropin releasing hormone agonists, etc., etc., aromatase inhibitors, NSAIDs, opioids, pentoxifillin, etc., etc. What leads to a postcoital bleeding? Atrophic vaginitis, cervical cancer, cervical polyp, all of them basically lead to the development of postcoital bleeding, but not adenomyosis. Fibroids and adenomyosis is a favorite topic of the examiner. What are all the causes of intermenstrual bleeding? Cervical cancer, IUCD, progesterone only pill, anything. Especially one of the disadvantages of the POP is on a fixed time of the day you have to take it, and whenever you take it there is a chance of intermenstrual bleeding. That will be giving a confusing picture. But advantages is it won't interfere with the breastfeeding, is what you need to understand. A primiparous woman of 10 weeks gestation with pervaginal bleeding with the passage of the products of conception. Cervical os is open. One question on abortion definitions. Missed abortion, incomplete abortion, inevitable abortion, complete abortion, septic abortion. किसमें cervical os open है, closed है, passed or did not pass the products of conception, whether the uterus is of the proportionate size or disproportionate size to that of the period of amenorrhea. Based on that, which abortion? जरूर एक क्वेश्चन आएगा. So doctor, we have an excellent teacher, Dr. Shilpa. Once more in the next season also Dr. Shilpa will be teaching gynops. So cervical os will be maybe open or maybe closed also, doesn't matter. But passage of the products of conception is a clue to tell that it is incomplete. Abortion is what you need to basically remember. So these are some more questions of Kerala PG.